Hi everyone, I'm Dr. Madhumita and you know me as MedicoMadhu. I've been answering the questions that have been asked by you. So again, in this episode, I would be doing the same. If you have any doubts, you can communicate with me through either a short clip of the video or an audio clip, or even you can text in the comment section. We will be taking your questions one by one. You can check the description below as to how you can communicate with me. So answering the first question put forward.
Hi doctor, a couple of years ago I had an appendix surgery. I felt fine for the first 6 months after the surgery. But then I started experiencing a gripping pain near my abdomen area once in a twice a week. Is this a normal after surgery?
Sir, I understand that you have undergone an appendix surgery about 2 years back and you did not develop any symptoms for about 6 months after you had undergone the surgery. So, the pain that you currently have looks most unlikely related to your appendix surgery per se. And you had mentioned only about abdomen pain. You did not mention whether it is restricted to the right side of abdomen, left side of abdomen, upper abdomen or lower abdomen. So I'll just brief you about it. Majority of the time, if it is the upper abdomen, if it is towards the left side, then most probably it is related to acidity and your symptoms actually matches with that more. If it is slightly towards the right side or in the lower abdomen, middle of the abdomen, it can be related to the gas in your abdomen itself. Majority of the time, this would settle down with short frequent meals and if you drink plenty of fluids and if you keep yourself more mobile. Majority of the time, taking lot of fiber rich food helps a lot. You can try that. But having said that, with a history of surgery, with an abdomen issue, I would rather suggest that it's been for 1.5 years that you've been having, just get one ultrasound abdomen and get yourself clinically evaluated by your doctor so that we know that this is only related to your acidity or gastric problem and nothing serious.
ನಮ್ಮ ಫ್ರೆಂಡ್ ಫ್ಯಾಮ್ಲಿನಲ್ಲಿ ಕ್ಯಾನ್ಸರ್ ಹಿಸ್ಟ್ರಿ ಇದೆ. ಅದರಲ್ಲಿ ಬಂದು ನಮ್ಮ ಅವ್ರ ತಾಯಿಯವ್ರಿಗೆ ಥೈರಾಯ್ಡ್ ಕ್ಯಾನ್ಸರ್ ಇದೆ, ಅವರ ಅಜ್ಜಿಗೆ ಲಿಂಫೋ ಕ್ಯಾನ್ಸರ್ ಇತ್ತು. ನಮ್ಮ ಫ್ರೆಂಡ್ಗೆ ಕ್ಯಾನ್ಸರ್ ಬರಕ್ಕೆ ಚಾನ್ಸ್ ಇದೆಯಾ?
ನೀವು ಹೇಳಿದಿರಲ್ಲ ನಮ್ಮ ಫ್ರೆಂಡ್ ಫ್ಯಾಮಿಲಿನಲ್ಲಿ ಕ್ಯಾನ್ಸರ್ ಹಿಸ್ಟ್ರಿ ಇದೆ ಅಂತ. ಅವ್ರ ಅಮ್ಮನ್ಗೆ ನೀವು ಹೇಳುದು ಥೈರಾಯ್ಡ್ ಕ್ಯಾನ್ಸರ್ ಅಂತ, ಅವ್ರ ಅಜ್ಜಿಗೆ ಲಿಂಫೋಮಾ ಅಂತ. ಸೊ ಇದು ಎರಡು, ಲಿಂಫೋಮಾ ಅಂದ್ರೆ ಅದು ಬ್ಲಡ್ ಕ್ಯಾನ್ಸರ್ ಒಂದು ಟೈಪು, ಥೈರಾಯ್ಡ್ ಅಂದ್ರೆ ಇಲ್ಲಿ ನೆಕ್ ನಲ್ಲಿ ಒಂದು ಥೈರಾಯ್ಡ್ ಅಂತ ಒಂದು ಗ್ಲ್ಯಾಂಡ್ ಇದೆ, ಅದರಲ್ಲಿ ಕ್ಯಾನ್ಸರ್ ಬಂದಿದೆ. ಮೆಜಾರಿಟಿ ಆಫ್ ದ ಟೈಮ್ ಈ ತರ ಇರೋ ಕ್ಯಾನ್ಸರ್ಸ್ ಫ್ಯಾಮಿಲಿನಲ್ಲಿ ಬರೋದಕ್ಕೂ ಚಾನ್ಸಸ್ ಇಲ್ಲ. ಬಟ್ ನೀವು ಹೇಳಿದಿರಲ್ಲ ಅವ್ರ ಫ್ಯಾಮಿಲಿನಲ್ಲಿ ಒಬ್ರು ಫ್ಯಾಮಿಲಿನಲ್ಲೇ 2 ಜನಗೆ ಕ್ಯಾನ್ಸರ್ ಬಂದಿತ್ತಂದ್ರೆ ಅವರು ಕ್ಯಾನ್ಸರ್ ಸ್ಕ್ರೀನಿಂಗ್ ಮಾಡೋದು ಒಳ್ಳೇದಾಗುತ್ತೆ. ಸೊ ನಿಮ್ ಫ್ರೆಂಡ್ಗೆ ದಯವಿಟ್ಟು ಹೇಳಿ ಅವ್ರ ಅಮ್ಮಂದು ರೆಕಾರ್ಡ್ ಮತ್ತೆ ಅಜ್ಜಿದು ರೆಕಾರ್ಡ್ ತಗೊಂಡು ಅವ್ರದ್ದು ಮೆಡಿಕಲ್ ಆಂಕಾಲಜಿಸ್ಟ್ ಯಾರಿದ್ರು ಅವ್ರ ಜೊತೆ ಒಂದ್ಸಲ ಭೇಟಿ ಆಗೋದಕ್ಕೂ, ಇಲ್ಲಂದ್ರೆ ಅವ್ರಿಗೆ ಅವರು ಫಿಸಿಷಿಯನ್ ಜೊತೆ ಮಾತಾಡ್ಬೇಕು. ಅವರು ಇವ್ರದ್ದು ಫುಲ್ ಬೇಸಿಕ್ ವರ್ಕಪ್ ಮಾಡ್ಬಿಟ್ಟು ಆಮೇಲೆ ಏನು ಟೆಸ್ಟ್ ಬೇಕಾ ಇಲ್ವಾ ಅಂತ ಹೇಳ್ತಾರೆ. So for all those who don't understand Kannada, this person has actually asked me that her friend's family has history of cancer. Mother had thyroid cancer and grandmother had lymphoma. Since these two are different cancers, thyroid is a gland whereas lymphoma involves the blood. So it's a type of blood cancer. Since they are not of the same type, most probably it can be something that has occurred on its own. So familial history might not be much significant, but considering that in the same family having two cancers, it's better that the friend gets it screened. So if your family also has two close relatives who have had cancer like this, then definitely get yourself also evaluated. That would help you a lot.
Doctor, can you suggest best remedies, homemade remedies, and as well as supplements that Indians who are living in cold countries such as Canada, Australia, Northern America, and also who are doing jobs which is pretty much indoor, like IT field, have to take, given the condition that our skins are much darker than the European counterparts or Caucasian counterparts? Thank you.
Thank you, sir, for the question. So you had mentioned that people who live abroad, especially in the cold countries, what are the precautions to be taken? Well, most of the time you will be affected by vitamin D deficiency. So the best would be to get your vitamin D levels checked, and weekly one supplement would be recommended for at least a period of about 8 to 12 weeks, followed by monthly supplements, because you are going to have a deficiency all through as there is not enough sunlight. And second thing, you asked about people who work in IT, what should they do? Well, it's not just about the skin, but also about the joints. So as much as possible, keeping yourself physically mobile and moving the joints, stretching the joints would actually help. Apart from that, again, there are so many diet factors that are involved. Like there are things that we might not get that we are usually used to, and our absorption definitely differs from that of the Westerners. And the quality of food, quality of absorption also changes. So in this case, I would suggest, based on your symptoms, let's say that you have too much of body pain, you're not able to concentrate, any of these things occurs, then a short course of multivitamins would be recommended. Thank you for your questions. You can also put forward your questions by either a video or a audio clip, or you can text in the comment section. You can see the description. I'll meet you all with many more videos.